Robotic surgery is an extension of the laparoscopic platform of surgery. And what that means is typically for intra-abdominal surgery, what was the laparoscopic revolution really started in the late 80s, early 90s, first with laparoscopic gallbladder surgery, where you put air in the peritoneal cavity, or really CO2 gas, insufflate the abdomen, so there was a window in there to look with little tubes. You'd put a camera in and tubes that instruments would go in and out of the tubes. There are valves to help hold the air in. And that changed everything, because gallbladder surgery used to be done open, big incision, took 2 months to heal, fairly painful, number of days in the hospital. With laparoscopic surgery, it was outpatient and would heal in 2 weeks. So immediately the benefit for the patients was it hurts less and heals quicker. So laparoscopic surgery took off and then went into other more advanced surgeries of hernias and colons and reflux surgery in the abdomen, and really set the course for minimally invasive technology in the whole nation, which then went into radiology. So everybody was saying, well, how can we do things with less trauma to the patient? And really changed everything. Because the engineers will always respond to, well, we need this, and then after a little while they would come up with something. And so it's always been advancing. Robotics has changed it in the addition of, we still put the tubes in the air in the abdomen. Then you hook the instruments to the robot. Laparoscopic surgery, you have an instrument in your hand that you're controlling and watching a TV monitor. So you have arm, wrist motion. When the instrument is held by the robot, you sit at a console which has binocular vision. So now you have depth perception, which you really didn't have before. And the picture is crystal clear. You control the camera because the robot holds it, not the nurse. The nurse is perfect and their hand will move a little bit. So there's the vision is a little shaky, but the robot doesn't move at all until I move it. And then the tips of robotic instruments turn greater than the human wrist. So now it's like you've gotten your hand inside the abdomen through a little tiny hole. So you can reproduce open surgery on what we call the robotic platform, and brings the ability to do more difficult laparoscopic surgery to more people you wouldn't really be able to do, I don't think, well laparoscopically. So actually then more people will get the benefit of minimally invasive surgery, which translates into less pain and feeling better sooner. And as long as we can continue to do these things with low risk and similar, if not better outcomes, I think it's wise to do that. There's a lot of discussion about robotic surgery. You know, it costs a lot, but we can show that actually it can cost even less if you do instrumentation judiciously and limit the amount of equipment you can use. You can do surgery cheaper than open or laparoscopic.